Shoulder dislocations is a very common problem, particularly in younger people and teenagers. In the shoulder, which is a ball and socket joint, what happens is that the ball is dislocated out. Now, when this happens, the labrum, which is a ring that runs around the socket, can tear and the ligaments can get stretched out. After someone has had their first dislocation and the shoulder's been popped back into place, what happens next? Do those patients need to have surgery right away, or can they first try physical therapy? Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York. I specialize in sports medicine and arthroscopic surgery. Surgeons will take different approaches to this same scenario of a first-time shoulder dislocation. Some surgeons will go non-surgical route where they'll have the patient go to physical therapy, let things calm down, regain range of motion, and then over the course of about 6 to 12 weeks as the patient improves, let them get back to their regular activities. Now, in younger patients and teenagers, there is a very high risk that their shoulder can dislocate again. Now, if that were to happen, then after a second dislocation, many times those surgeons will then recommend that the patient have surgery. Now, other surgeons will take a different approach here. Because there is such a high risk of the shoulder popping out a second or third or multiple times in patients who are very young, like teenagers or young adults, they will take the approach to just have surgery immediately after the first dislocation event to reduce that risk. A dislocation, again, where the ball comes out of the socket and gets put back in, is not a benign event. It can cause damage to other structures in the shoulder, like the labrum and the cartilage. And after multiple dislocations, the risk of developing arthritis down the road does increase significantly. There was a study published in 2019 that randomized 88 patients who had their first dislocation to either arthroscopic repair or what they call a sham surgery, where they just washed out the shoulder but did not repair any of the structures. And all these patients were under the age of 35 and were followed up for 10 years after surgery. And they found that those who had the arthroscopic repair surgery had a significantly lower risk of having more dislocations. It was only 12% risk of having another dislocation versus 47% of those patients who did not have the repair. There are many factors that go into consideration before having surgery for a shoulder dislocation. And one of them that has to be considered is the risk of having more dislocations and developing arthritis down the road. Thanks for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.